Hey, this is Medicare news on Google for November 2nd, 2021. These are the top headlines here. So, Geisinger to pay $18 million after violating Medicare rules. That's from WTAJ. Crane, and then Brooklyn, Bronx hospital amongst most penalized by Medicare for poor outcomes. That's from Crane's New York Business. A day ago, the Philadelphia Inquirer, Medicare Advantage plans free dental vision hearing benefits come at a cost. The devil is in the details. That's a day ago as well. This is political. A day ago, Democrats closed in on Medicare prescription drug negotiation compromise because Medicare does not negotiate drug pricing with the manufacturers directly. From Cincinnati Inquirer, Medicare punishes 18 greater Cincinnati hospitals for high readmissions. So the federal government efforts to penalize hospitals for excessive patient readmissions is ending its first decade. The New York Times, why aren't more people comparison shopping for health plans? Most Medicare beneficiaries don't compare plans during open enrollment season and may be paying more. That was a day ago. Cleveland.com, 6 things you need to know about signing up for Medicare. The CT Mirror, Medicare punishes 2,499 hospitals for high readmissions. That was 3 days ago. The Hill, can we really afford to change Medicare Part D? And the last one here on Medicare News on Google is Biden's plan to add dental coverage to Medicare faces pushback. All right, so we'll go into a couple of these because not all these are consumer specific, but I wanted to get into a few of them because of the different things that are going on the news currently right now. So this is from the Philadelphia Inquirer, Medicare Advantage dental vision hearing, and so a lot of these plans, Medicare Advantage plans, are being touted on all the marketing outlets, and so what this article is essentially saying is that there might be some limited benefits, but you have to be within the network, and you don't know the actual benefits on these Medicare Advantage plans with dental care until you actually get on the plan. So that's not very transparent for the 42% of Medicare beneficiaries, which is around 26 million people enrolled in Medicare Advantage plans. And these are private plans, which means the insurance companies manage your care and they get paid handsomely by Medicare per enrollee per month, about 4% more than traditional Medicare. And so they're very incentivized from the top down, insurance companies, brokerages, and down to the agents themselves. And that's why they're pushing zero premium plans. But they do have additional benefits, but a lot of times you have to qualify for the extra benefits, and that's where Medicare Advantage plan companies are being not so transparent, as well as they're bordering on false advertising, because you have to have certain health conditions to qualify for some extra benefits like groceries or transportation, and or like extra coverage that is in addition to what the health plan is supposed to be for you. So just know, even when you have the plan, you don't qualify for all the benefits on these Medicare Advantage plans, when it comes to the dental coverage, as well as some of the extras that they're touting, like groceries and transportation. Okay, let's go on to the next one here. And this is from the New York Times, and this is a really big one that I've discussed in past videos about. 98% of Medicare beneficiaries don't shop their plans annually because of all this, high pressure solicitation and high pressure marketing, and so this one here is New York Times. Why aren't more people comparison shopping for health plans? Most Medicare beneficiaries don't compare plans during open enrollment and may be paying more or accepting more restrictions than they should. And that is a known fact, because duration of coverage does adversely affect Medicare premiums on individual insurance policy, health insurance policies. And so this is just an example of Eunice right here, where if she had a Part D drug plan, she would be paying $301 as opposed to out of pocket of $1,100 for her prescription drugs. And it goes into some other things like using your state health insurance assistance program. There's over 12,000 SHIP volunteers out there that are unbiased because they're not licensed agents, but they're allowed to talk to you about the actual insurance programs, companies, options in your area, in your state for Medicare beneficiaries, and they would refer you to someone that is licensed as a specialist for whether it's Medicare Advantage with Part D, with say you're a dual eligible Medicare beneficiary with Medicaid, full Medicaid benefits, or say you're a higher income earner but you want to protect from your downside on the 20% co-insurance, so you're looking for a Medigap policy. So just know that all premiums, all healthcare premiums go up over time, even if they do start from zero. Okay, and we'll end with this right here. So yeah, they're saying call 1-800-Medicare, and let's see what it says about Medicare Advantage. Okay, this is here. The Centers for Medicare Advocacy, a nonprofit group, has charged that Medicare itself has shown bias towards private Medicare Advantage plans in its promotional materials starting in 2017. They started overplaying some of the benefits, which is true, and downplaying some of the negatives. I think they wanted private health insurers to thrive, which is true. It provides competition. It provides an alternative to original Medicare, which has a higher out-of-pocket cost when you have it in tandem with Part D drug coverage and a Medigap policy. But you get what you pay for, is the old saying and adage, and so it is the golden standard traditional Medicare, and that's from Rutgers. With a Medigap policy, but these Medicare Advantage plans have very, very high back-end spending, especially if you have chronic conditions and don't have a way of paying those max out-of-pockets for yourself. Say if you have cancer treatment or have even medications that aren't covered. Cancer medications that aren't covered on these Medicare Advantage plans. Okay, so Medicare gave 4 stars. Okay, so now it's saying that Medicare gave 4 stars or higher to 68% of the 2022 Medicare Advantage plans with drug coverage, making the rankings less than useful for comparison. So when you are comparing Medicare Advantage plans, it's very, very hard to discern what extra benefits you'll actually get when on the 2022, because no one's going to read the details or the explanation of benefits unless you're very, very thorough on each and every Medicare Advantage plan, and that's why you can't do a side-by-side comparison, whether it's a PPO, an HMO, or an MSA. There's literally over 4,700 Medicare Advantage plans in the United States, offered in the United States throughout. So it makes it almost impossible to do side-by-side comparison. But if you do have a specialist in your area with the Medicare Advantage plans and know the hospital systems and know how they're billing for certain procedures that you might have coming up, then you can get ahead of the game. Okay, Medicare Advantage. Okay, so here's the last thing. This is a big one. Medicare Advantage also restricts full coverage only to doctors, hospitals, and pharmacies within their network. If patients go outside of the network, they face higher costs and may have to pay entirely out of pocket, which means you foot the bill. In-network providers change frequently. That's true because of each and every year they change. Doctors don't have to stay on the actual plan, but the consumer does for an entire year, and it can be challenging to ascertain which ones a plan includes. So except for emergency or urgent care, Medicare Advantage coverage may not extend outside beneficiaries, county, or state. If you're in Albany, you may not be able to get care in New York City. This is from a doctor, Dr. Jacobson. Advantage plans also often require prior authorization. Ooh, that's in. So this is on all over YouTube. prior authorization from the insurer for services and drugs. And that is a big one, because you think you're getting something that's comparable to Medicare, but the fact that insurance companies are allowed to audit your health care, whether it's your medical services or whether it's your medications from your doctors, that is another layer that delays your healthcare services, and that doesn't typically happen when you're on Medicare A and B, when you go to your doctors or your hospitals, because there is no prior authorization with traditional Medicare. And it says it right here. Traditional Medicare, you can see any provider you want to anytime without getting prior authorization. Dr. Jacobson said it's accepted nationally, but factoring in private Medigap policy and a separate party plan sometimes pushes overall costs higher, which is very, very true. Again, you get what you pay for. Okay, so New York Times, this is definitely a good article if you are trying to look into comparison shopping. It seems very unbiased, and it's telling what I think is a very much transparent what's going on with both sides, whether it's Medicare Advantage or traditional Medicare. It's giving you a good rundown and a hassle-free way of getting some information from the SHIP programs in each and every state. Okay, let's go to the next one here. Oh, this is the latest news on Medicare, and will Medicare be expanded in the final reconciliation bill? And so this is something Bernie Sanders is touting. So let's just take a listen here. All right, let's see what Bernie has to say. All right, here we go. All right. Alright, let's see if we can get this to work. Alright, Bernie, let's see what you got. Alright. Oh, I have to restart it, that's why.
Right now, the pharmaceutical industry is doing everything that it can to make sure that 1 out of 4 Americans is unable to afford the prescriptions that their doctors write. People are dying. The cost of insulin is totally 10 times more in this country.
Will you vote for a bill that
Canada.
doesn't include
now, anyone
that?
tells me...
You're talking about how important it is. Would you vote for a bill that doesn't include changing what you're describing as a very big problem?
As soon as I leave the studio, I'm going to be going back home to get on the phone to make sure that we have it. The American people, over 80% of the American people, give you an example. Right now, the Veterans Administration is paying half because they negotiate prescription drug prices. They are paying literally 50% of what Medicare is paying. Does that make any sense to anybody? You have one government agency paying half as much as another government agency. That has got to be dealt with. We are working very hard to make that happen.
All right, I'm not making a political stance. I'm just reviewing the news here, and Bernie's obviously very salesman-like when it comes to the prescription drugs, but it is a very good point, because I know Medicare beneficiaries personally that pay thousands and thousands of dollars for tier 3, 4, 5 medications, and it is something that is a big burden to their household and their retirement dollars. So that would be really great if Medicare could pass the bill to negotiate drug pricing for its Medicare beneficiaries, which would be such a great benefit, because you're thinking that you're going to get on something really good when you transition into Medicare, but then you have a sticker shock when you start paying for your tier 3 and tier 4 or tier 5, or even some other medications that you normally would get covered under group health insurance. Okay, so last thing here, guys, is there anything else? No, I think for right now, yeah. So currently on the table, the Biden administration is trying to push the bill to get affordable Part D drugs for its beneficiaries, pushing dental, vision, hearing for its traditional Medicare beneficiaries. and you're getting a lot of solicitations and high pressure tactics during this time, during open enrollment, and that's why people don't shop their plans. But I do all my stuff through video, and you can email or contact me if you have questions. You can go to my channel, Mike C. Fishbox /Medicare Savings, or you can just do Medicare Savings. If you want to find us and actually get a free analyzation and review, that's what I've been doing throughout this AEP open enrollment. And so you can, the best way to, I think, is to go on to Bing, because Bing actually recognizes our organization, Medicare Savings, and you can just click on here and just go on there and then click, or just click on the maps, whichever way. But if you're using Google, just put Medicare Savings Charleston, or just go to medicaresavings.us, and we help you with either path, whether it's a traditional Medicare, which I personally like because my mother and parents are on it, or my mother was on it and my dad was on it as well, and that is the most comprehensive route. If you're someone who's more cost sensitive, then you can go the Medicare Advantage route for less front end spending, but know that there's a lot more back end spending. So either way, make sure you're basing it upon your health, and that way you know what to expect and you don't have some costly Medicare mistakes in the future. So hopefully these news videos are important for you to listen to. Let me know if you have any questions regarding your Medicare path, your Medicare questions, and obviously don't listen to all the advertisements upselling benefits when you really don't know what it means to your health in the future, because that's where the most out-of-pocket cost can be, is paying for procedures and treatments that you don't know the actual cost of. So take care, God bless, thank you so much for listening in.